Hello juniors, so I welcome you all again in the continued series of lower limb, and today we are going to cover an important topic which is the venous drainage of lower limb. So in today's topic we will be covering its introduction, veins responsible, mechanism of drainage and its clinical relevance. So without wasting any further time, let's move ahead. So starting with the introduction of the venous drainage of lower limb. So venous drainage of lower limb is a complex system responsible for returning deoxygenated blood back to the heart. So as you must be knowing, arteries carry the oxygenated blood and veins bring back the deoxygenated blood to the heart. The venous drainage of lower limb is of great importance because in the lower limb, venous blood has to ascend against gravity. As you all must be knowing, the blood from the lower limb has to ascend against the gravity to reach back to the heart. The factors helping the venous return. The negative intrathoracic pressure, which is made more negative during inspiration. So when you inspire, the chest muscle contracts that lead to increase in the thoracic cavity. The diaphragm moves downwards, and during inspiration the overall volume of the thoracic cavity increases, and due to the volume increment there is a negative pressure buildup. The negative pressure buildup pulls the blood towards the heart. This is similar to an exercise you have done many a times in your life. So when you have to harvest water from any container and you have a hose, then you suck the one end of the hose and creates a negative pressure at one side of the hose. That negative pressure drives the water towards the end. Arterial pressure. The arteries, the blood in the arteries are already coming with a great pressure. That pressure from backward pulls the venous blood upward to the heart. Compressions of vein accompanying arteries by arterial pulsation. So if this is a vein and there are accompanying arteries, so when the arteries receive pulse from the heart, they manage to compress the vein, and that compression of vein leads to the flow of blood again back to the heart. Presence of valves divides larger veins into shorter compartment and also maintain the unidirectional flow. As you must be knowing, veins are equipped with valves, and these valves make a larger vein into the shorter compartment. So this is the valve. If this is a single vein, this vein is divided into shorter compartment, and valves prevents the retrograde flow of blood, that is they maintain the unidirectional flow, that is towards the heart. Now before deeply diving into the mechanism of venous drainage of lower limb, you need to have a basic knowledge of the types of veins responsible for drainage. So the veins responsible for drainage are superficial veins, perforator veins and deep veins. So we will be covering them one by one. Superficial veins. As the name suggests, the superficial veins are located superficially just beneath the skin. The major superficial veins include the great saphenous vein and small saphenous vein. I'll show you the picture of this in a minute. Superficial veins drain blood from skin and subcutaneous tissue. And eventually superficial veins connect with the deep veins. So this is our the third number vein is our great saphenous vein, and the fifth number vein is our small saphenous vein. So as you can see, this both great saphenous vein and small saphenous vein are located superficially. Now the perforating veins. These perforating veins connect the superficial and deep veins. Firstly, as the name suggests, perforating, that is, it is perforating something. Perforate from outer surface of the leg to the inner leg. So perforating vein connects the superficial and deep veins, allow for communication and blood flow between them. So if this is our superficial vein and this is our deep vein, which is lying deep into the leg, and these are the perforating veins which connect superficial vein and deep vein simultaneously. And there are five major sets of perforating vein, which I'll cover eventually in the later section of the video. For now, coming to the deep veins. The deep veins are located within the muscles along with the major arteries. So the deep veins are usually accompanied with the major arteries. The major veins, the major deep veins include the femoral vein, the popliteal vein, anterior tibial vein, and the posterior tibial vein. The femoral vein, starting from external iliac vein, continues to become the popliteal vein, and the popliteal vein then continues to give its branches, the anterior tibial vein and the posterior tibial vein. The deep vein drains the blood from the muscle and the deep tissues. So this is the picture that will make the whole thing clear to you. So this is our superficial vein, and these are the superficial vein which are lying just beneath the skin. As you can appreciate, they are lying just beneath the skin. They drain blood from skin and superficial fascia. And this particular vein is our great saphenous vein. And right here, the opposite to the great saphenous vein is our small saphenous vein. As you can appreciate, both are lying just beneath the skin. Now looking at the deep veins. So here are the deep veins which I am marking with my pen. These are the deep veins lying in between the muscles and in the depth of the compartment of leg. Deep veins drain blood from the inner portion or from the middle of the leg and from the muscles. And eventually the deep veins and the superficial veins get connected with the help of the perforator. Right here is the perforator vein. So here is one perforator vein, here is another perforator vein, here is another. So these perforator veins connect the superficial vein with the deep vein. So this is our perforator vein. So coming to the mechanism of drainage of venous blood from lower limb. As I've already discussed the few mechanism which drains the lower limb venous blood. So firstly, the respiratory pump mechanism. This I've already discussed with you, but here is the hi-fi name given of this mechanism. We have already covered that negative intrathoracic pressure is built in the thoracic cavity, which pulls the blood up to the heart. Secondly, the muscular pump mechanism, that when the limb is active, that is while you are walking, jumping or running, the muscular contraction compresses the deep veins. As I've already told you, deep veins are lying in between the muscles. So the muscular contraction compresses the deep veins and drives the blood upward. Arterial pressure, as the arterial blood is already coming with the high pressure, it pushes the venous blood up to the heart. Compressions of the veins accompanying arteries by arterial pulsation. As I've already discussed this with you, that the accompanying arteries and their pulsation will compress the veins, and that will push the venous blood back to the heart. So this is the new point regarding the anatomy of the veins of lower limb. The veins of the lower limb are more muscular than the veins of any other part of the body. So if you take the vein of a upper limb and if you take a part of vein of lower limb and you compare them, you will find that the veins of lower limb are more muscular. This is because the veins of the lower limb have to work more to push the blood back to the heart because of gravity. The veins have to work against the gravity to push the blood back to the heart. That is why they are more vascular. They are more muscular than any other part of the body. And lastly, the presence of valves, as I have already discussed with you. So this is the overall picture of the superficial perforating vein and deep vein, and with the help of this picture you will be able to appreciate all we have discussed till now. So this is the inguinal ligament and this is the external iliac vein. So external iliac vein continues to become the femoral vein. This is our femoral vein. Just beneath the inguinal ligament, the femoral vein gives a branch called as great saphenous vein. This is the great saphenous vein. Right here is the great saphenous vein. The veins in this diagrams which are color coded with light blue color are superficial veins, and the veins which are given the dark blue color are the deep veins. So as you can see, the great saphenous vein is the superficial vein and the femoral vein is our deep vein. And right here is the adductor canal. Remember this adductor canal for our later point. I will discuss this with you. So the femoral vein continues and goes posterior to the knee joint to become the popliteal vein. Here is the popliteal vein. This popliteal vein gives a small branch called as small saphenous vein. This is the small saphenous vein, which is again a superficial vein. This small, right here is the small saphenous vein. Popliteal vein also gives two more branches, which are the anterior tibial vein and the posterior tibial vein. This one here, right here, color coded with dark blue color is our anterior tibial vein, which means this is a deep vein. And similarly, the posterior tibial vein, which is lying posterior to the tibia bone, is also a deep vein. I hope you are able to appreciate. Now whenever the question will be asked regarding the venous drainage of lower limb in your examination, you have to compulsorily draw this diagram, and I'll teach you how to decode this diagram and how to go through this diagram. So as I've already told you, we are starting with the external iliac vein, which is right above the inguinal ligament, and external iliac vein continues as femoral vein. This femoral vein gives a branch called as great saphenous vein, which is a superficial vein. This is the great saphenous vein. This right here, this is our femoral vein, and it gives us a branch which is the great saphenous vein, which extends up to the bottom of the foot, right here till the dorsal venous arch. This is the path of the great saphenous vein. So similarly, in this diagram, this is a schematic diagram of all those veins which we have covered right now. So this is the great saphenous vein, and parallel to the great saphenous vein continues our femoral vein. As I have told you before, to remember the adductor canal. So this is the point where our first important perforator vein is lying, which is also known as Hunterian perforator, which is named after a great anatomist who discovered and briefly explained the perforator. And this perforator vein is lying in the mid thigh. So this is the level of adductor canal, and right here a perforator is lying which connects the great saphenous vein with the femoral vein. As we continues to follow the femoral vein, here comes the popliteal vein, which is lying posterior to the knee joint. Here the popliteal vein gives a branch called as small saphenous vein. This is the small saphenous vein, or also known as short saphenous vein. This short saphenous vein continues with the great saphenous vein by forming a dorsal venous arch. So right here was our great saphenous vein, which continues to become dorsal venous arch along with the short saphenous vein. And popliteal vein also gives us a branch known as anterior tibial vein and the posterior tibial vein. Right here is the anterior tibial vein and here is the posterior tibial vein. And these veins form another important perforator known as the knee perforator or Boyd's perforator, which is present at the knee joint, below the knee joint. The great saphenous vein also gives a branch known as posterior arch vein. This posterior arch vein connects with the posterior tibial vein right here with the help of three perforators known as the three medial ankle perforators of Cocket, which are once again the three medial ankle perforator of Cocket lying in between the medial malleolus and mid. I'll show you picture of this in a minute. And the peroneal vein, which is a branch of posterior tibial vein, connects with the short saphenous vein with a lateral ankle perforator. So showing you picture of all these perforator in this diagram. So with the help of this diagram you can able to see the three medial ankle perforators of Cocket, which are right here present in between the medial malleolus and the mid calf. So right here somewhere is the medial malleolus and this is the mid calf. The three perforator veins are right here. This is the first one, right here is the second one, and this is the third one. They all three together are called as the perforators of Cocket. In this diagram you can't see the adductor canal perforator or knee perforator, but eventually you can Google them and visualize them easily. Now coming to the clinical relevance of the venous drainage of lower limb. Firstly, the varicose veins. So these veins are enlarged and tortuous superficial veins which are due to the inability of the veins to pump blood effectively back to the heart. So this is a normal vein with normal valves, but when the vein becomes defective, the blood is pooled in the veins and this lead to engorgement of the veins, and that phenomenon is called the varicose vein. The condition varicose vein is very normal in elderly people where the musculature of veins it get weaker with the time. And our next relevance is the deep vein thrombosis. So deep vein thrombosis is the formation of blood clot in the deep veins, which is due to the stasis of blood, that is the ineffective movement of blood. As you can appreciate in this image, firstly the blood is getting hindered, that lead to the pooling of the blood right here. And that ineffective movement or slow movement lead to formation of a blood clot right here. And in some circumstances that this blood clot gets detached or gets broken into pieces and an emboli is formed. So this is an emboli. This clot can get dislodged and an emboli can form which can travel anywhere in the body, and that emboli is a life threatening condition. Varicose ulcer. So varicose ulcers are formed due to impaired venous return back to the heart, which are formed due to the pooling of the blood. So when the blood is getting pooled right here in the lower limb, so this pooling of the blood can lead to the growth of various bacteria and other harmful agents which can cause an ulcer to form. So completed with the introduction, veins responsible, mechanism of drainage, and its clinical relevance. If you found this video helpful, do like it and do share it with your friends. Thank you.